Hey everyone, week 2 update. I am in the MyUJ website under our personal health and wellness class. First, I want to talk about assignments that are due. You have 2 assignments this week, and you also have an exam to take. So, if you did not get me your Chapter 10 quiz and your stress assessment, please do so as soon as possible. Those were due yesterday, so if you didn't do those, you can still do them. It will be the 10% deducted per day late. We are right here on the Chapter 12. The sexuality and health quiz is due on Friday, April 3rd, and your advocating for sexual assault prevention assignment is also due on the 3rd. And then you will have, well, it is open right now, exam 3, which is chapters 9, 10. Remember, we skip 11 and 12. That exam is due Wednesday, April 8th. So you have those 3 things to be working on. If you have any questions on any of them, please let me know. So chapter 9 is on the weight management chapter. So that is the last chapter that we finished in the classroom. So you're going to have to pull your notes from when we were actually meeting in school or before spring break, and then 10 and 12 for both since we moved to the online format. Okay, so that is what we have open for assignments right now. Please download the handout for chapter 12. I did add chapter 9, so if you didn't bring your notes home with you when you left for spring break, the notes are on MyUJ, so you do have them available. And then 10 and 12. So I'm going to run through to highlight just a few points of the chapter 12 PowerPoint. I already have it open here. Okay, chapter 12 covers sexuality and health. So, objectives for this chapter are learning the internal and external parts of the female and male reproductive system, explaining birth control methods, advantages, disadvantages, symptoms, diagnosis, prevention, treatment, and transmission of bacterial and viral STIs. One thing I want to highlight is the treatment of STIs varies depending on if it is bacterial or viral. This is a question that has been stooping a few of you that have taken the quiz already. A bacterial STI can be treated with an antibiotic. However, a viral STI is similar to any virus that you get in your body. You cannot treat it with an antibiotic. Consent. What consent means, how it relates to sexual assaults. Okay, the reproductive system differs between females and males. Cannot identify using ultrasound until the 20th week of gestation or the female's 20th week of pregnancy. Okay, the different parts of female and male development. I'm going to go through these pretty quick. I just want to highlight some of the important parts here. Okay, female reproductive system internally and externally relies on hormones. There are different hormones of the female body that are required for sexual reproduction. Female reproductive systems, the internal organs include the mammary glands of the breasts, the ovaries, the uterus, and the fallopian tubes. The external organs are the vagina and everything that makes up the vagina. Okay, female, I'm going to skip through this. Here is the internal female reproductive system. So the external part is the vagina, then the internal part begins at the cervix, cervical canal, the ovary, fallopian tubes, and the uterus. The uterus is your thick-walled muscular organ. At the base, it forms the cervix. If a woman does not become pregnant during ovulation, then the uterine lining is stripped or shed and menstrual cycle begins every 28 to 32 days. That is a normal cycle. Okay, I'm going to keep going here. Mons pubis is the soft area made of fatty tissue that covers the pubis bone. Now, another visual of the female reproductive system. This would be the external organs. Males, primary role of the male reproductive system are to produce the sex hormones, produce, store, and transport sperm and semen to aid in fertilization, stored in the testes. Ability to produce sperm begins at puberty, ages 9 to 12. Here are the male reproductive system. Differs from the females. Study the anatomy of the male reproductive system. The testes produce testosterone and sperm, so those are both housed in the external structure of the scrotum. Urethra allows for both sperm and semen to leave the body. Okay, I'm going to keep going here. Okay, contraception is a way to prevent pregnancy. Birth control is more of the common term that we use in place of contraception. Okay, visual here of the percent of adults or those who are sexually active, what they are using as a form of contraception. So as you can see, most commonly a form of condom is being used, most popular in 2011 to 2013, and that just, you can see, decreases on all of the different forms of birth control. Okay, percent being used, men and women, and the different age groups. Okay, birth control methods. Abstinence is the word that we use for choosing to not have sex, waiting to be sexually active until the time is right for you. So abstinence is the only contraceptive that is 100% protective against pregnancy or STIs. Okay, barrier birth control methods create a barrier that prevents some STI transmissions, so that would be a latex condom. There are male and female condoms. Female condoms are less common, but they are inserted into the vagina. Smaller circle covers the cervix. Cannot be used with a male condom. Okay, statistics of contraceptives and their success or failure rates. Diaphragm, I'm going to skip past some of these. Cervical cap, please read through these. I'm just going to skip past them for sake of time. Birth control pill is probably one of the most common, if not the most common, form of contraceptive. Contains progestin and estrogen, which are two hormones that prevent fertilization and inhibit ovulation. So most birth control packs contain 21 days worth of pills with hormones, 7 days of those without hormones, which are when you have your menstrual period. Missing a pill decreases the effectiveness of this form of contraceptive. Implant contains progesterone. It's a small flexible tube that is placed under the skin of the upper arm. Lasts for 3 years until it is removed. The patch is as it says, a small patch that contains progestin and estrogen. It's applied to the abdomen, shoulder, side of the arm, prevents ovulation, thickens the cervical mucus. Vaginal ring, common one is the NuvaRing. It's inserted into the female's vagina. It releases low doses of estrogen and progestin to stop ovulation. The shot, every month, females can receive a shot. IUD. IUD is as shown here. It is inserted into the vagina. Morning after pill is taken, hopefully within the first 24 hours after sex, to prevent any sort of pregnancy occurring. STIs, so as I mentioned, it can be virus, bacteria, or a parasite transmitted STI. Most common viral STIs, HIV, AIDS, or HPV, genital herpes as well. Viral STIs cannot be treated, can be treated but not cured. So they're commonly diagnosed. The bacterial STIs are chlamydia, gonorrhea, or syphilis. I'm going to have you guys continue reading through. This is a fairly long chapter. However, please read through the rest of it on your own. Read through all of the sexual assault pages here, or note pages, and work on learning this chapter. If you have any questions, please reach out to me. This is all that I'm going to update for this week. So any questions or comments, please shoot me an email, text, or phone call, and let me know how things are going. Good luck on the exam. You will be able to see your responses, or what you got right and wrong, as soon as everybody has submitted it and it's fully graded. So please come back and check on what you got right and wrong. That is all for this week. Stay safe and have a great rest of the week.